and good morning, or possibly good afternoon or good evening, depending on where around the world you are logging in from. Welcome in. Make yourself at home in the webinar room. We're going to get started really soon. I just want to make sure that we hang on for just a moment so all those extra people who are joining just now are able to join before we get started. Hi, Doug. So while we are there we go. While we are waiting, please say hello to us with your name and where you are logging in from. I always like to know that because I want to see how far around the world we can reach. So let's see. Lance from Nashville, Ashkit from hello everyone. It says Ashkit, and then Susan from San Diego, Charles, Denver. Oh, it's going fast and furious now. Carla, Lisa, Stephanie. Oh my gosh, Indiana, Belgium. Ooh, nice. Albuquerque, Canada. Martinez, Maryland. Nice. More Canada. Oh my gosh, it's going so fast, you guys. You guys are going. You're seeing it too, right? And Damon's from Earth. Welcome. Anne is from Menlo, Arkansas. Amber, Christine, Heather, Allison from Idaho. Hi, guys. So I just really love seeing, it's just a marvel, the internet. It never ceases to amaze me every time how you can like literally just log in on a link and be connected all around the world. It is lovely. It is lovely. Ron, hi from Lawrenceville. Patricia, aloha. And then Philip from Tallahassee, Phoenix. Karen says 408 represent. That's awesome. Let's see who else. I'm gonna flip back up here now. Temecula, Biff, hi. Biff's in my challenge right now. Hello. Elaine from BC, Deborah, Tennessee, Sybil, hi Sybil. And then Laura from Stroudsburg, Pennsylvania, Melody from Alberta, Brian from Los Angeles. Wow, you guys, you're all around the world. It's super, super, super exciting. All right. Well, while more people come in, because we're having a really good crowd here, the numbers going up, up, up. Maggie from Tucson, hello. I think that we're going to go ahead and we can get rolling started here because I do an introduction. You just guys keep on just saying hello in there. We like to say that. Is Grant chewing nicotine? What? What is Grant chewing nicotine gum? I don't think Grant is chewing nicotine gum, Susan. Okay, hang on. We're going to get started here. Welcome once again to everyone to our February live event today.
He's chewing his cuds.
Today we have an amazing presentation for you today, and we've got the Microbiome Masterclass. And even though we're going back to school, I guarantee you will not fall asleep in this class. So just speaking of the microbiome, the awareness and science of the microbiome has come a long way in a very short time. Quite amazing, actually. It wasn't really until about the 2010s that this information started to really surface and become more widely embraced by the medical field and more well-known by consumers as well, eventually leading to at-home microbiome testing, of course, and many, many possibilities that come with new microbiome discoveries every day for health and wellness. But we've only scratched the surface. And I have two fantastic doctors here with me today, one of which happens to be a true trailblazer in the pursuit of bringing the human microbiome to the forefront of integrative medicine. I also like to tease him by calling him the godfather of the microbiome. So I will say that again.
Which is better than the grandfather. Right?
I brought in the grandfather. Exactly. He also pioneered the concept of the home lab testing. So, obviously, we love him. Dr. Stephen Barrie is our VP and head of clinical nutrition here at Viome. Hello, Stephen.
Hello, Lisa. Happy to be here.
There you go. And then next to him or below him, depending on how big your screen is
sometimes above me.
Yeah, above you. Okay. Is a member of Stephen's team, the really incredibly knowledgeable Dr. Grant Antoine, who serves as the clinical lead on the precision nutrition team here at Viome. He's my trusted encyclopedia for all things biology and nutritional science related. I pretty much can't do a webinar without him. Hello, Grant.
Hello, Lisa. Thank you, guys.
And he's my doctor. So.
Yeah, exactly. There you go. So there we are, all three of us there, but it's really Dr. Stephen and Dr. Grant who is going to be presenting this class today, not me. I'll be the color commentary. So gentlemen, let's proceed with this masterclass. I am going to hand things off to Dr. Barrie, please.
Great. Well, thank you, Lisa. Let's see.
You got it? Can you click on it?
I'm clicking, but nothing's happening. We
Hmm.
didn't test this in Chrome, did we?
Oh, no, it should be able to go. If not, oh,
There
there
we
you go.
go. There we go. Yeah,
Excellent.
great. Yeah. I'm excited to be here. And as Lisa mentioned, the field of the microbiome has been around in a small little niche for 100 and some odd years, actually, going back to the early 1900s. And if we think about yogurt and stuff like that as a food, there was a connection to yogurt and bacteria even 125 years ago. But as Lisa mentioned, it never got the attention of the medical establishment until probably the last 15 years, 20 years. And that's because of the development of something called next-gen sequencing. So all of a sudden, researchers had the ability to really understand and identify all these microorganisms. And we'll talk about what they are in a second. So first I want to mention, the microbiome is all these microscopic critters, right? They're bacteria, they're viruses, they're phages, they're parasites, they're yeast. And while we as Viome talk about it in terms as it relates to the human body, they're actually all around the earth. They're in the air, the water, the soil. Life wouldn't exist on Earth without this microbiome. In the soil, they're very important for the growth of plants. Actually, plants need a healthy microbiome in the soil for them to grow. So it's important from a world perspective. And then, of course, from our perspective, it's very important from a human health or animal health point of view as well. When we talk about the human microbiome, we're really thinking about, at least from my own perspective, three areas. The oral microbiome, all the bacteria, viruses, that live in your mouth, the skin microbiome, and then the gut microbiome. Right now, there's microbiome in your ears, in women's vaginas, in your belly button, in your eyes, in your lungs, everywhere. There's even in breast tissue and breast milk. Okay, there's a microbiome, which has effects on health. But we deal with these three things specifically. And I thought it'd give you some facts some of you, may know, but, I think they're so interesting, it's worthwhile hearing them again. And there's just a lot of these cells in your body, okay, more than all human cells, right? So the microbiome is actually a bigger part of what's happening in your body than the human cells, 40 trillion versus 30 trillion. And there's a lot of different kinds, over 1,000 different species, and they all perform different tasks, right? And they're not all bad. In years past, people thought of the microbiome, physicians, healthcare people, as bad, right? You had bad parasites, you had bad bacteria causing diarrhea or upset stomachs. And that's what the world of the microbiome was. But then as it developed, we realized they do a lot more important things than the bad things. We said a lot of them, they weigh like almost 5 pounds. That's like a pineapple. So there's a lot in there. And a quick overview of some of the things that they do. Serotonin, which is what makes us feel happy, it's a hormone, a chemical, and actually 90% of the serotonin produced not in your brain, not in hormone glands, but by the GI microbiome. And actually, your gut contains more neurons than your spinal cord, so it's very much involved in how you feel and the connections between the gut and the brain. Additionally, almost all of your immune cells are in your gut's lymphoid tissue and they interact with the microbiome. The immune system, the key part of the immune system is the health of your microbiome and how it interacts with these cells that are lining the gut wall. So what influences it? Why do you have a good one or a bad one, and how does it change? So it turns out there's a very complex interplay of factors. Everything from the food you eat, the environment that you live in, right? So your diet, in terms of having a poor microbiome, insufficient fiber, excess, too much consumption of highly refined carbohydrates, processed foods, and refined sugars. These are the most common disruptors that affect the microbiome. Unfortunately, in the United States and around the world, the Western diet includes not enough fiber, a lot of refined carbohydrates, a lot of processed foods, and a lot of sugar. And all that leads to a imbalance in the gut, a more bad bacteria less good bacteria. Okay. Interesting, your lifestyle actually affects your microbiome. Chronic stress and poor sleep affect the microbiome. And it's a two-way street. It's a bidirectional thing. So stress, poor sleep affect the microbiome, causing dysbiosis, an imbalance of the bacteria, and also an imbalance of the bacteria caused by something else can affect your sleep and increase your stress. Medications can affect the microbiome. We always think about antibiotics. Antibiotics, while they may kill bad bacteria that are causing a health problem, they also kill all the beneficial bacteria. So they kill everything indiscriminately. So you may wipe out the bad bacteria, but you've now wiped out the good bacteria, and that causes a whole set of other problems in your body. But most people don't know that even things like non-steroidal anti-inflammatory drugs and statins and painkillers all contribute to gut dysregulation. So medication is a key factor. Now, another unknown for most people is your environment, the cleaning products you use. And by the way, these are all published studies in the last 5 years that show this. But the cleaning products that you use, and therefore the air that you breathe, has an impact. Chemicals, pollutants, pesticides, all influence both the stability of your microbiome and the character and nature of your microbiome. So there are a lot of reasons to think about, less pollutants in your environment, less pesticides. One important reason is also to have a healthy microbiome. Now, it all starts in early life, right? It starts with a vaginal birth. And for example, babies that are born from a C-section are actually kind of sterile, don't have a good microbiome when they're born. They don't get it from the vaginal canal from the mother. And actually, they show that 30 years later, they have an increased incidence of all kinds of chronic diseases, probably due to the fact that they didn't have the early exposure to the microbiome. There are actually hospitals now that are spraying babies with a mixture of what would be the vaginal microbiome onto the baby to start the whole process early on. So what are the dangers? We talk about having this unhealthy gut imbalance. What are the dangers from a health point of view, right? And we said it affects, not just your immune system, not just your digestion, but your immune system, your mood, your skin, energy levels, fatigue, if you have food sensitivities, hormonal imbalances, for example. Skin problems, as we mentioned before, your skin has the microbiome, and if that's imbalanced, it leads to inflammation, premature aging, wrinkles, etc. So microbiome important from all these aspects of health. Additionally, such as COVID-19, it was shown that people who had imbalanced microbiome had a more severe COVID-19 episode, and actually people who have long COVID had an imbalanced microbiome. Parkinson's disease, Alzheimer's disease, ADHD, obesity, diabetes, cardiovascular disease, hypertension, colon cancer, IBS are all related to an unhealthy gut. Again, a two-way street. But these are all factors that are caused by increased risk of these conditions or the actual cause of the conditions. And that's the imbalanced microbiome. So how do they work? Well, they interact together, right? They form a community. And actually, a bacteria that sometimes does good things, it sometimes produces good metabolites, good chemicals. If it's in the wrong environment, that has the wrong neighbors, if you will, the wrong family around it, it can produce bad bacteria, which is one of the things I think Grant probably will talk about why what Viome does is we're looking at the gene expression, the RNA, not just who's there, but what they're doing. If you just look at who's there, you can't tell if they're being good or bad actors. So you have to measure what they're actually doing. And we do that through biochemical pathways and the RNA signaling. So what are some of the signs that your microbiome are out of balance, right? Such seemingly unrelated things as fatigue or brain fog, post-meal bloating, digestion issues, bad breath, skin issues, low libido. These are all associated with a microbiome that's out of balance. I wanted to highlight some interesting examples of something that most of you probably are not aware of. And while the attention in the past 20 years has been the gut microbiome, in the past 5 years, the oral microbiome has become highlighted, right? And we realized that the bacteria in the mouth, besides with poor digestion getting into the rest of the body, that actually the bacteria or the chemicals they produce can actually go through what we call leaky gum. So gums are inflamed, gums that people have periodontal disease, right? They have an inflamed gum. So these metabolites now cross through the gums into the bloodstream. And if we look at this on the right side of the screen, for example, women who have an imbalanced oral microbiome have a 7 times increased risk of adverse pregnancy outcomes, including preterm birth and low birth rate. So just by having an imbalanced oral microbiome, a pregnant woman can have a 7 times increased risk of an adverse outcome. I mean, it's a real key thing to, one, get your oral microbiome measured, and two, make sure you're flossing and brushing and getting your teeth cleaned properly. How about premature death? Women have a 12% higher risk of premature death who have a history of periodontal disease. Up to 50% of heart attacks and strokes are triggered by oral pathogens. 70% more increased risk to develop Alzheimer's disease, people who suffer from gum disease for more than 10 years. Imagine, you're 70% more likely to have Alzheimer's if you don't treat your gum disease for more than 10 years. Diabetes, right? We think about diabetes, sure, eating sugar and processed foods and all of that. But people who have diabetes, most of them also have periodontal disease, which lowers glycemic control. So the bacteria are affecting the body's ability to regulate the insulin, regulate how you utilize and uptake the sugar. So it's not just cavities, not just gum disease or tooth loss. It's actually everything about the body. And it's been estimated that probably 70% of all chronic disease has a relationship to the condition of the microbiome in your mouth. And this has just not been paid attention to except in the last 2 or 3 years. And dentists are starting to understand this. They're starting to understand their role in the whole health of the patient. And I think we'll see a lot more of that in the future. So every day, those of us in the clinical nutrition team get articles automatically from Google about the microbiome health, et cetera. And every day, there's probably 5 to 10 articles that just amaze us all in terms of the relationship that we find of the microbiome. Whether it's colon cancer, whether it's pancreatic cancer, whether it's breast cancer, right? Everyday articles relating to the relationship of the microbiome to these diseases. You know, how would breast cancer, you would think, have anything to do with your gut microbiome? Well, it does, intimately. And actually, dysbiosis of the breast tissue, this microbiome the breast tissue has, is related to the increased risk of breast cancer. We find that the microbiome is involved in the degradation of various drugs. So a drug may not be effective in someone because they have an imbalanced microbiome. This is true, for example, in Parkinson's disease. L-Dopa, which is the drug that's typically prescribed for Parkinson's, 35% of the patients don't respond to it. It turns out they're not responding because their particular microbiome actually is degrading that drug, and it's no longer effective. We find that a good microbiome can affect cancer therapy. So many cancer therapies in terms of immunotherapies don't work as well if somebody has an imbalanced microbiome. So if we can discover beforehand what the microbiome is like, we can treat the microbiome, then that drug becomes a lot more effective. Going back for a second to the oral world, in terms of implants, the ability of an implant to stay is related to the microbiome. So if one can understand the person's oral microbiome ahead of time and can be treated if it's out of balance, then there's a better chance of that implant remaining in play for a lot longer. So those are just some of the examples of the kinds of things that get discovered every day. And those of you who you might have fun, every now and then, just Google, health conditions in the microbiome, or ask ChatGPT, and it'll show you the latest. Or just ask ChatGPT. You can put in a prompt. What's the latest interesting research on the relationship of the gut microbiome and chronic disease? And you'll be quite surprised at the list that comes up every day. So the key is, what do you do about it, right? We understand this relationship. We understand its incredible importance to our health. I didn't mention longevity or what we call healthy lifespan, healthy aging, but big connection to that, obviously. As you reduce your risk of chronic disease, you now have increased your healthy lifespan, dramatically. So the things are, we want to understand each of our own situation. We want to adjust our lifestyle to maximize it, and perhaps take whether supplements or pre, and postbiotics to help get back in balance. But we have to take an active role in it if we want to make a difference. So
there you go. Nice. That was definitely a masterclass on the microbiome and the history of it and everything that it affects. Thank you so much for that.
It was like boom, boom.
As you can tell, I'm energetic about the topic.
Yes, absolutely. And we are too. Definitely, Sylvia loved that. Thank you, Sylvia, for the applause and the hearts. Awesome. So people that are experiencing a little bit of issues with the audio and video, if you can hear me, refresh your browser and rejoin with the link, and that should help. Sometimes the bandwidth on your provider side is a little bit waning, and you just need to refresh it. So hopefully that will help. So there we go.
Lisa, I just saw one of my dogs. I think people saw walked behind. I was going to mention, and our pets have a microbiome.
That's right.
And there's actually testing. We don't do it in Viome, but there are tests to test your dog or your cat's microbiome, and there are probiotics and postbiotics and prebiotics for them as well. So, because same thing, their health is affected by what's happening with the microbiome in their gut.
Awesome. That's why it's good to cuddle up with your pets.
Oh, yes. Oh, good. So that's really important. The germs, the bacteria that the dogs bring in on their feet and their mouth and stuff, that's actually good for us. Okay, so exposure of that, people who are exposed to farm animals, people who are exposed to their pets, have a much better microbiome and translate to a healthier lifespan than those who don't, actually.
You're stealing my thunder a little bit. I was going to talk about that with community.
Oh,
in my
there you go. Sorry.
Pets are part of our community.
No, it's great. No, that's awesome. Well, are we ready to move on?
Yeah.
Then, guys, there's going to be a little bit of overlap with what Stephen just discussed, but it's important. But we wanted to take some of these ideas about the microbiome and then relate them back to your health, right? Because it's always, all right, we know the microbiome is important, but how is it important to me? How is it impacting my day-to-day? Top things that we think about for our health: sleep, weight management, our fitness. Those are kind of the things we want to talk about next, and just give a little introduction, a little taste of how the microbiome and these health factors might be interacting. And then maybe a few tips or things for you to be thinking about as you're trying to improve both your microbiome and your health. So up first is going to be sleep. Might not be as obvious to some folks initially, but the microbiome and our nervous system are intimately related. There's a two-way street. We talk about it all the time, the gut-brain axis we just mentioned. But the more we start to learn, everyone knows about circadian rhythms and the impact. If we disrupt those circadian rhythms, then they can disrupt our sleep, not just the amount of sleep, but the quality of our sleep, right? Also another very important variable there. But it also impacts our microbiome, which is interesting, right? Our microbiome has its own circadian rhythm where it's trying to align with ours. They want to know when those meals are coming, right? And meals and meal times are very important in setting our circadian rhythms. And the more in sync the physiology of our body and the metabolism and the microbiome are, then the more benefits we get. And it's turning out more and more that as these rhythms get disrupted, then that activity in the microbiome becomes more influential on our sleep. We now know because of animal studies that we can actually improve the quality of our sleep by paying attention to the microbiome. In fact, giving specific prebiotics and fibers to those microbes so they can produce those metabolites that then communicate with our brain and nervous system, improve REM, improve the quality of our sleep. We get better, higher quality sleep because of these microbes. I don't know that anyone would have guessed that, right? Years ago, like what are you talking about? What are these bacteria? How can these bacteria affect my sleep? And more recent studies, we're starting to see that even the abundance of specific microbes seem to have an even more profound effect. So bifidobacterium would be an example. We're still trying to uncover exactly how they're mediating their effects, right? What are the metabolites? What are the mechanisms of action? But we know there's a connection here. And if we want to be dialing in our sleep, we want to be paying attention not just to our sleep hygiene, right? You still need to be thinking about dimming the lights, limiting your exposure to blue lights, whether that's by turning off all electronics or using your filters or your special glasses. Winding down, finding a mindfulness practice, whether that's breathing, meditation, maybe some light stretching or yoga. Maybe for you, it's reading. Always puts my kids out. I don't know about you guys. But you still need to be paying attention to those things. But what can we do with our microbiome? So again, those fibers, chamomile, it seems to always be a popular, pre-sleep drink, which is turning out there's actual compounds in the chamomile. Everyone kind of experiences that initial calm, but apigenin, which is a compound, is actually feeding our microbiome and producing beneficial metabolites that we think also are improving the sleep over time. So, fun little thing there. And again, I just want to reiterate stress, because we talk about mindfulness and we're going to talk a little bit more about stress. But when it comes to sleep and that stress in our immune system and that nervous system, give feedback back to the microbiome, which then reciprocates and gives us feedback back to our bodies. So managing that stress, not just for your own mental, emotional health, but for your microbiome's health is even just as important. We'll talk a little bit more about that in a second. What's next? Food and your microbiome. So diet is the number one influencer of our microbiome, right? By far. When we're feeding our cells, we need to think about what nutrition do we need to be feeding our bodies, but also what nutrition do we need to be feeding our microbiome, right? We always want to think, hey, I know I need to get my nutrients. I want to protect my liver. I want to feed my microbes. Those are kind of the top three things that should be going through our minds every time we're creating our diet plans or filling our plate. When it comes to food, we're often thinking, okay, well, how can I eat to not just get the nutrition I need, but how can I lose weight and stay fit, lean and mean? And more and more, again, we're starting to understand how these microbes are playing a role. They can actually curb or limit the progress that we get from any particular diet plan. If we're on a weight loss, we're on a caloric deficit, these microbes can actually determine how we respond to that diet plan and those deficits. They can impact our cravings, right? There's binge eating, you think. I can tear through a bag of potato chips. I hate it, but it's true. My wife has to keep the chips out of the house. I will, yeah, go through it just mindlessly. But it turns out these microbes play a role. There's certain
Right.
microbes that want those simple sugars, and they actually drive those cravings, and they inhibit our own natural, I guess, mechanisms that normally we would feel satiated and full and satisfied. They can override those and influence and keep us providing those carbohydrates that those microbes are looking. And we see this more and more with antibiotic use, right? Post antibiotic use, you see these cravings and these impacts are even greater than what they might normally be. So, if I was going to geek out a little bit, there was a recent study where they had over 600 participants, and they came in, half they put on a low-fat diet, the other half they put on a low carb, and they watched them for 6 months, and they want to see, hey, well, who responded the most? It turns out because they were experiencing the same caloric deficits, they actually lost the same amount of weight in those 6 months, regardless of the diet type. Right? There wasn't a significant difference. But then when they monitored them after the 6 months, there were some that continued to lose weight, right? So intervention for 6 months. Okay, we all lost weight. We're all happy. What happens the next 6 months? Well, it turns out those on the low-fat diet that were still getting their fibers, they had a microbiome that was sustaining that weight loss, right? They had developed the microbiome and that plant power, if you want to say, that ability for your microbiome to ferment those fibers and produce those metabolites that we need so desperately for our health. Those folks that had the healthier microbiome saw continued weight loss despite stopping the interventional diet. That's powerful, right? So it's how can we, again, harness this microbiome to continue to leverage it to improve our own health. And you'll see a common theme here, right? What does the microbiome need, and what can it give me?
Yep.
Right? What do I need giving the microbiome that it can give me? In this particular example, butyrate is what we're looking for, right? Butyrate's a wonderful molecule that we need in so many areas of our health, whether it's for our gut lining, right? The cells that line our gut and protect us from what's happening inside the gut. Use that butyrate as a fuel source. It helps them heal, helps them replicate, helps them stay strong and maintain that barrier. Butyrate in our liver, it signals our mitochondria. It helps us with blood sugar regulation. In our pancreas, it helps us with insulin release. And so that whole spectrum of insulin sensitivity, prediabetes, diabetes, butyrate's playing a role. It even affects the genes that we're expressing to help control our metabolism. Fatty liver and the deposits of triglycerides into fats into the cells, and that pathogenesis also influenced by butyrate. Butyrate in the brain, anti-inflammatory, helping with mood. We'll talk again about that in a minute. But just a powerful molecule that we can't develop ourselves. We really rely on that microbiome to produce for us. But if we don't have, one, the microbes in there to do the work, and two, provide those microbes with the substrates they need, again, to give us the metabolites we need, that's never going to happen, and it's going to be a detriment to our health. Fibers being what we need, those fermentable fibers provide to those microbes. They'll ferment them, produce the butyrate, and then we benefit. So just always be keeping that in mind. So a couple of things. What do you need? You need thinking about your microbes for weight loss and sugar control. Then we need to really be thinking about that terrain of our microbiome. So when you're making your plate, 75% of it, you want to be plant-based. You want those vegetables, those plant-based foods. You want to be giving those fibers, those polyphenols to help create that environment, that terrain, again, so that they're healthy and happy, and they make us healthy and happy.
Yay, healthy and happy microbes.
Right? Who thought? Like, who would have thought?
Fiber. We don't get enough of it in our diet, especially not from foods. Obviously we have fiber supplements, but foods is the way to go, I feel.
Yeah, and we've had the long hard focus on fibers, right? But we kind of missed some emphasizing. The polyphenols would be an example, right? You think about the colors in your food, the purples, the greens, the reds, the yellows. Those colors are the molecules that benefit our microbes in our bodies. So you always hear about eating the rainbow and eating as many colors and diversity as you can. Those polyphenols have a very similar prebiotic effect, have their own benefits apart from fiber. But those polyphenols, those microbes' metabolism, they activate them, make them more antioxidant, more anti-inflammatory, right? We think about pomegranate, for example, the ellagic acid that's in there. We want to want the microbiome to metabolize that and turn it into urolithin A. That benefits our mitochondria, right? Our mitochondria helping us with energy, with endurance. Very important when it comes to cognitive health and performance here, which we're going to talk about a little bit. So movement, endurance, recovery, you might not expect it, but again, the microbiome having an impact here. More of an impact in longer duration events, endurance events and that endurance performance. It turns out that a good microbiome can help us with that lactate balance. So anyone that's done a hard workout, you feel that burn, that's that lactate and that CO2, that kind of acidic environment starts to build because of the glucose metabolism and that activity. The microbiome can help us with that. It can help us buffer that lactate. It acts as a sink to help drain the blood levels of that lactate, and then actually can use that lactate to produce butyrate, right? And again, we just talked about all the benefits of butyrate, but that butyrate is going to help us with that gut lining and anti-inflammatory effect. Can be really important when you're talking about on a competitive level, how long can I perform at my best, right? Especially when we think about long duration, multi-day events, when recovery becomes that much more important, right? Because yeah, you could bust your ass the first day, but you still got days 2 and 3. So you need to make sure you're recovering so you can continue to perform. So the military is paying attention to this. The U.S. Army, they're looking at how can we support our soldiers, because they obviously have multi-day endurance events, right? They're endurance athletes. They're using symbiotics, a combination of probiotics and fibers, prebiotic fibers, to support the microbiome, which then again benefits the soldier. So how is it doing that? Intestinal permeability, you talk about leaky gut, we talk about all the time, becomes a big deal, especially with wartime stress and longer duration exercise, right? That exercise plays a toll. That stress response can loosen up that gut lining and make it more permeable. Well, if we can support the microbiome while we're doing this, you make that gut lining that much stronger. You're going to reduce inflammation. That's going to promote recovery. It also helps to reduce brain fog and that kind of the fog of war we all talking about. Again, going back to that gut-brain axis, and they're seeing some benefit here. So what can you do about it? Hey, I don't know how many soldiers we have in the room or how many endurance athletes, but glutamates can be a great amino acid. We talk about that post-recovery, so maybe including a little extra butyrate into your protein smoothie or whatever it is, your post-workout recovery meal, whatever that looks like. Glutamate is going to help support, acts a little like butyrate. It helps, acts as a primary fuel source, energy source for those cells lining our gut, helps them recover and maintain their bonds, keep it strong. Another thing I always like to think about is anytime I'm taking a protein supplement, including fiber, and I don't care if it's a plant isolate, maybe it's a mixture of soy or pea protein, rice protein, or a whey protein. Always thinking about, again, what does my body need right now? We need that amino acid and that protein. What do my microbes need right now? Well, I don't want to be giving them amino acids. Too many amino acids for those microbes, they're going to ferment those. And it turns out a lot of the negative byproducts of the microbiome are from the fermentation of amino acids. There are some good benefits, but the majority of them not so good. And again, if we're thinking about what we can be feeding the microbiome, hey, let's throw some fiber into that protein shake. Let's throw in some resistant starch, some molecules that are going to make their way down into the colon. So now, even if there is amino acid present, the bacteria, they prefer the fibers, right? And these plant-based carbohydrates, they're going to preferentially ferment those and leave those amino acids alone. So I always like to add a little bit of fiber, maybe 5 grams of fiber. I go big, actually. I'll go 5 grams fiber, 5 grams resistant starch, but I've kind of built myself up to that. Your significant others might, or your coworkers might appreciate it if you start slow there, just because of the activity and the gas that these things can produce. But as you build up a tolerance, you get less and less gas, and you can take in more. And really just a call out to any athletes that are in the room, we need to be thinking, if you're going to be competing and you have multi-day long events, really be paying attention to your nutrition and how you can be recovering. And not just in the sense of muscle and electrolytes. That tends to be, hey, I got my protein, my electrolytes, but hey, again, these microbes, what are you feeding them? How can they help me recover? Stress and mood. Anyone here stressed? Yeah, don't turn on the news. There's going to be a little bit of overlap of sleep here, but we can't overemphasize the importance of the gut-brain axis and this communication that's occurring. That vagus nerve, which is a cranial nerve, our largest cranial nerve in the body, travels from the brain all the way into our gut in multiple sections of our gut. It's this like an information superhighway where the brain and the gut can communicate with each other. And there's actually more signals from the gut going to the brain than from the brain to the gut. So let's think about that. That means there's more information that brain needs from the gut than what the gut needs from the brain. And really the gut and the enteric nervous system is a kind of brain. And when we see more primitive organisms, that is the primary brain in those organisms, that enteric nervous system. It's so important because the inside of the gut is the outside world, right? And the brain has a vested interest in knowing what's going on inside that tube and controlling to protect ourselves and our health. So what those microbes are doing, again, so important. Microbes themselves can influence neurotransmitter production in our own bodies, and they can actually produce neurotransmitters themselves. So one example, influencing serotonin production. We have a Viome score that measures serotonin taxa and the impact that they have on our own serotonin production. In the gut, serotonin is very important for motility and communication. And so the majority of the serotonin, like Stephen mentioned, is produced along the digestive tract. But then also, we take that tryptophan that's coming through the diet, we convert that to 5-HTP and serotonin. We're also sharing that 5-HTP with the brain, which can then use it to create neurotransmitters, melatonin and serotonin in the brain. Gut microbes are controlling that. They're influencing that. They can influence how much of that serotonin and 5-HTP is created through the metabolites and signaling that are occurring in the gut. GABA is another great example. GABA, think of it as a neurotransmitter for maybe relaxation, a calming effect. Again, these microbes can specifically produce GABA. In the gut, GABA has, another impact on motility. We see disrupted GABA activity in the gut with disorders like irritable bowel syndrome. But we can actually feed these microbes. The substrates, glutamates can be a good example. Foods that are rich in glutamate, mushrooms are going to be a great example. Azuki beans, another great example. I give those substrates, they can produce that GABA, and then we can benefit, have a good impact on our mood and our guts. We also can just take probiotics that we know are stronger GABA producers. So if we see a deficit there, we can bring in those probiotics, strains like D. longum, L. helveticus, or kind of little mini GABA factories that we can bring in if we detect a deficit there to help support those pathways. Again, I want to emphasize when I'm talking about the microbiome impacting our mood and stress, but that it's, again, a two-way street. Be thinking about how that stress might be impacting your gut. And we see with anxiety, with stress, with depression, you see more and more dysfunction and dysbiosis, not just in the composition, but the activity of that microbiome. Again, these mindfulness practices, staying grounded, and it's not just for us, it's for our microbiomes as well. All right, last slide, guys, for me. The community microbiome, we already started to touch on this a bit with the pet owners. I just talked a little bit about how microbes affect our mood. They also can affect our behavior. There's studies where we've seen in animals where we can cause dysbiosis or disrupt their microbiomes, and we see changes in behavior. And actually, the more dysbiosis we see in the microbiome, the more anxiety, the more depression, and the more isolation we see, the more withdrawn animals will become. They don't want to go explore, they don't want to socialize. And then conversely, the more fit, the more metabolically diverse their microbiome is. These are animals that they have improved mood. They're going in, they're socializing more, they're interacting more, and they're more adventure seeking. They're curious, and they're getting themselves out there, which is interesting because if you think microbes, what do they want to do? They want to replicate, right? They want to expand. They want to they want to go from one human to the next, right? That's beneficial for them. So if microbes are healthy and happy, and then they're somehow controlling our behavior, they're more likely, because of our interactions, to cross over and transfer to another human, another organism. So in that way, the microbe benefits, right? From an evolutionary perspective, they're becoming more fit and thriving. So it's kind of weird. Are we just meat puppets walking around with the bacteria in control? Maybe not 100%, but there's definitely influences there. So several studies in this area. It's very, very interesting, very intriguing. But what can you do? Get out there. The more we can get out there, and the more we can be in our communities, sharing foods and I don't know, sound weird, but like touching and interacting with each other, then the better. We talked about the pet owners. They tend to have more diverse and more metabolically active microbiomes. Those pets are coming in and sharing their microbes. Dirt, we're talking about. Get out there, play in the dirt. Kind of hygiene hypothesis and the overuse of antibiotics and hand sanitizers and home cleaning products we talked about. This has an impact. So the more you can go out, connect with nature, and get exposed. You got to remember the soil is a source of beneficial microbes. There's even spore-based microbes that we found in soil, and we now have probiotics that are very beneficial for us. The more we can, again, go out there and expose ourselves. So I love the farmers markets, getting out there, looking for those organic fruits and vegetables. That the health of that soil is going to determine the health of the microbiome that's associated both with the soil and the plant, right? That plant has its own commensal microbiome, just like we do. And if that's a good, healthy microbiome, that's going to be transferred to us when we consume those foods. So always looking for that fresh local produce, and you can have those conversations with the farmers, the producers of the produce, and what are they doing or not doing, more importantly. So just a couple of more tips there. But yeah, I think that's the end, guys.
Oh, yeah. Okay, so we have a little time for questions, but since Grant popped it up, I will definitely.
My bad.
I want to make sure that everybody here gets our discount code. It's Feb Webinar, one word. If you use that at checkout, you can get $100 off a full body intelligence test, which is our flagship test, uses all 3 samples, saliva, stool, and blood, in order to analyze your current health and give you recommendations for food and supplements. So I definitely recommend that you try that out. But we do have questions, and while we are not going to be able to answer all of them in this session, apologies, we are going to tap into the knowledge of these gentlemen that they have here and get it going. But I also have 2 people helping in the background, if you haven't noticed. Janelle and Hillary, who are also part of our clinical nutrition team, have been jumping in and answering questions. So thank you very much to you too. So let's see what we have. Some questions here. Let's see. We've already been over I think we talked about this, but Mary Carolyn is asking, what are the effects of statins? I have to take them. I think this came in early in your talk, Dr. Barrie, about talking about how statins affect your microbiome. What is the basic effects of that on your health and your microbiome?
They reduce diversity.
Right.
So which would lead to something which we call dysbiosis.
Mm-hmm.
It's an imbalance of the community.
So there you go, Mary. That is the effect of statins on your microbiome. Definitely check out a test if you'd like to check into finding out what's happening with your body and what nutrition you can have to support better health. So Eddie asked, this is also for you, Stephen, are cleaning products more harmful than what is being cleaned? Which I thought was an interesting question. So we're getting rid of viruses and bacteria, I guess, on surfaces. Is the cleaning products worse, or the what we're cleaning up worse?
So cleaning most chemical cleaning products used in the kitchen, the bathroom, etc., not only affect the microbiome on our surfaces of our body, but affect the microbiome through inhalation into our lungs. And we didn't talk about it. We didn't talk about the microbiome of our lungs, but that's a very key aspect of things as well. And then you end up swallowing it.
Mm-hmm.
You know, it's in the air, it's aerosoled. The fumes get in, you end up disrupting the oral microbiome as well from the fumes of all these chemicals.
There are natural ways to clean, I believe, that do kill bacteria on surfaces. So it might be, hi, there's a dog in the background. There might be some great ways to do some research and figure out what cleaning products are best for you that give you that balance. Yeah.
And the key is minimizing, right? I mean, you know, we live in a world, we're exposed to air pollution, we're exposed to chemical pollution.
Right.
You know, so we have to, the key is what can you control in your environment to the best of your ability? Because we can't live in a bubble and we're moving to Antarctica or whatever. So yeah, we're going to be exposed to all this stuff, but what can you control in your environment to minimize the exposure?
Excellent. Right? All right. So this one's for Grant. Somebody piped up about fiber and the carnivore diet. Michael says, regarding the insufficient fiber affecting gut negatively, may I ask your thoughts about how it is that the carnivore diet is leading to significant health changes? I've read some interesting information on this, but he's asking from a place of not knowing how significant progressions happen and hold up on this diet if there's low to no fiber intake. Well, I know for sure that the carnivore diet is not a long diet. If you're going to do it, you definitely shouldn't be using it.
So any diet, and we know this,
any fad diet that does very extreme things, right?
Immediate results. So if your goal is weight loss and you're going to cut out all the carbs, absolutely, because carbohydrates are a primary source of fuel. We take those carbohydrates, we convert them to triglycerides and fat, and then we store that fat for later because we tend to overconsume those carbohydrates. But you're still, and I don't care what the diet is, you're still just inducing a caloric deficit. So whether that's low carb, low fat, we talked a little about that in the study that I mentioned, you can still see the benefits from the diet, no matter what it is. You can go gluten-free, and because you're going gluten-free, you're cutting out carbohydrates and you're going to lose weight. So there's multiple angles, there's multiple paths to get to that caloric deficit. I don't care what you call it. And you can still see the benefits. Now, a lot of people will go to the ketogenic and carnivore diets because they already have a dysbiotic microbiome, and they've lost some of that ability to metabolize and ferment plants and fiber. And so when they eat these foods, then they get a lot of gas and bloating and uncomfortability because, again, they're not processing those constituents well. So when they move to something like a low FODMAP diet, ketogenic, carnivore, you're pulling out those fibers, but then you're also further supporting that dysbiotic activity in your microbiome, right? And sometimes you've got to go through those strides. Start low and slow with the fiber introduction, but over the long term, reintroducing, having a whole food plant-based diet is going to be more beneficial for you than anything like pure ketogenic or carnivore. Again, because you're harnessing, you're leveraging the microbiome, you're feeding those microbes what they need to give us what we need. And over the long term, even if you have a little gas, bloating, discomfort up front, just like exercise, the more you go, the more you show up, the more you work out, then the less pain there is, the more fit you become, the larger or the more improved the training response you experience. So always think about, where can I start today? Not just in the gym, but where can I start with a plant-based diet and bring in these fibers? I know these are going to disrupt me or make my stomach upset. What can I do? Now, obviously I'm going to be a little biased and tell you, hey, you need to test with Viome. We can look at your scores. We can see which fibers or which probiotics are going to be better for you and help mitigate methane gas, sulfite gas, gut line, whatever it might be for you. That personalization is key. But if you're going to just start today, making sure that you get your vegetables in, that healthy plate we were talking about earlier, where it's 75% plant-based. Have a few servings of vegetable, healthy grains. Bring that fiber in for those microbes. I still, bringing your protein, whether it's plant-based or animal-based, it would be minimizing saturated fat. Yeah.
Yeah, I have two additional comments. One, the ketogenic diet, to be real clear, and the carnivore diet have been shown in multiple studies to have negative, medium, and long-term effects. So as Grant mentioned, they might accomplish some weight loss, some other things, but only for a short period of time.
Right.
After a short period of time, you're causing a lot of harm to the body. And I often share this with people when they talk about the paleo diet and this healthy diet. Remember the average age of someone who had the quote caveman diet, right? Paleo diet, about 16, right? They died when they were 16, 17 years old. An old person in those times was, 22, 23. And yes, they died from being attacked by animals and perhaps poor sanitation as well. But there's nothing that says they were healthy people. Why didn't anyone say, hey, we need to eat like the cave people ate? Why would you think that, in my opinion, when they died when they're, teenagers? So there's nothing that says that's where humans should be eating, because look how well they did when they were, cave people. Anyway, something to think about.
Yeah, it's the paleo diet. I'm going to give a hall pass because I feel like the paleo diet gets misconstrued, and then people that try to implement a paleo diet, they end up going ketogenic and overemphasizing the meats and fats, and bacon would be an example. But the paleo diet, like the official paleo diet, that bacon's a processed food, and they want you to stay away from processed meats. And they're really plant forward. They advocate for that 75%. So there's a spectrum there. Even with ketogenic diet, there's the, hey, I'm just going to eat cheese and pork rinds all day ketogenic diet.
Yeah.
Spectrum. There's like, no, I'm going to pull out, simple carbohydrates. I'm going to emphasize low glycemic fruits and vegetables, right? While still trying to put myself into ketosis, kind of like a flex keto would be an example of that, where you can do keto healthily, or a more beneficial keto than the pork rinds and bacon and cheese. So spectrum there, but ultimately we know it's these plants. These plants are activating the benefit of the microbiome that's within all of us. Now, knowing the combination of plants that's right for your microbiome and for you, that's where Viome comes in to help personalize that. But in general, the more plants you can eat, the more vegetable, the more fibers, the more grains you can bring in, the better off in the long term you're going to be. And that's going to be because you're harnessing the power of the microbiome.
There you go. So we have lots and lots and lots of questions coming in, and unfortunately we are at time. This always happens when we have a nice science-based webinar. People are like, I want to know about this, I want to know about this, because it just like stirs up like all the imagination and the possibilities of what you can do when you eat right and balance your microbiome out. So thank you, Stephen. Thank you, Grant, for lending us your brains today and giving us answers to all of these questions. And Hillary and Janelle in the background, thank you too for answering everybody's questions. I really appreciate it. And thank you out there in the crowd for hanging with us for the last hour and listening to our information and taking it in and being so active in the chat. It's been a fantastic chat today. So thank you.
And thank you all for taking the time, the interest in your health to want to learn more things. And, you know, this is what we've talked about here is one aspect of how you improve your health. So you're the ones to be congratulated to wanting to learn and change your lifestyles.
Absolutely. Thank you to you out there in the audience, and come back next month. We will have another great topical content webinar like this, and we will see you all again very soon. Please use the Feb webinar discount code. It's good through Sunday, so you can do that and pick yourself up a full body intelligence test if you like, and get tested and find out what nutrition is right for you right now. All right. So thank you to gentlemen, and thank you to the audience. Everybody have a wonderful rest of your day and a great
Thank you,
weekend.
Lisa.
Thank you.
Thank you. Take care, everybody.